Dr. Tarbox, we've had so many questions about touching surfaces, especially gas pumps. That's the newest thing going around Facebook. Talk about how long these things live on surfaces and how we can best prevent that.
We want to be really thoughtful about what we're touching when we're out and about as this virus is making the rounds, because we found that it is relatively infectious. And we've got some good data from the NIH that tells us how long this virus can persist on surfaces, and it varies per type of surface you're talking about. So if you're talking about a cardboard surface, we know it can live for about 24 hours, a stainless steel surface up to 2 days, and a plastic surface up to 3 days. So the surfaces that a lot of people touch out in the community very well could be contaminated, and you have to be cautious as you're utilizing those surfaces. The people who are worried about the gas pump handles, I think it's a very reasonable concern, because that's one of the things you kind of can't avoid dealing with right now. I think the best approach is to presume that the surface is is contaminated, and try to be cautious as to what you touch after you've come in contact with that surface to avoid any transmission. When we're learning how to do surgical scrubbing in medicine, we get very cognizant of what we're touching with our hands so that we're not moving contaminants from one surface to another. And that's one area in which sometimes wearing gloves can be beneficial, because it can remind you that there might be something on your hands you don't want to put on your face. So I do see more people in the community wearing gloves, and they can be helpful if they're used as that reminder, but they're not any kind of a magical cure-all. So they're not repelling the germs or the viral particles. If you touch them with the glove and then you touch your face with your gloved hand, you could still transfer the disease. And so you still want to be thoughtful and cautious about that. So the best thing to do is just what we kind of refer to as universal precautions. Presume that every surface that you might come in contact with in the public space could be contaminated. Be cautious about touching your face after you've come in contact with that surface, and hand sanitize frequently.
And this goes for ATMs, everything. Talk about kind of that list.
Oh, absolutely. So the most contaminated surfaces that we run into in public settings can include things lots of people touch. So not just gas pump handles, but ATM buttons, touch screens in fast food restaurants, elevator buttons, door handles, and sinks and faucets, as well as soap dispensers in public restrooms. Now, you've got to touch the soap dispenser to get some soap on your hands, but after you've touched that and gotten the soap, you can go ahead and wash away all of the grime and grit that's on the hands and any bacterial or viral contamination that might be there. And then a big pro tip is to get your paper towel ready before you wash your hands, so that you're able to tear that off right away, dry your hands, and then use that paper towel to open the bathroom door. Most public spaces are smart enough to have a waste bin near the door, so that you can toss that nice protective little piece of paper towel into the little waste basket as you walk out.
Very good. Dr. Tarbox, thank you again for joining us. We certainly appreciate it.
Thank you so much.